I don't have any. I'm probably just staying home, watch some movie maybe. How about you, Maylene?
Yeah, probably to the laundry. Or I have a work on Saturday.
Oh wow, you have a shift on Saturday.
Hi. Excuse me, I'm a student nurse from Bow Valley College. I'm just like wondering if you can help me to calculate the dosage and flow rates for my patient.
Sure.
Is that okay? Thank you. Here's my patient.
Okay, so my doctor's order of cefazolin is 450 milligram and my stock dose is 500 milligram. How can I calculate the dosage?
Okay. Okay, so your medication is cefazolin. So this medication needs reconstitution, so you need to consult a monograph and you need to see under reconstitution, there's an instruction below here and dilution to reconstitute with sterile water injection. And if your available dose is 500 milligrams of vial, you need to add 2 ml for a final concentration of 225 milligrams per ml. Okay, so here the formula for the computing the dose is dose desired over dose on hand times the vehicle. So your dose desired, which is the doctor's order, is 450 milligrams, and then your final concentration is 225 milligrams.
Is it because we're gonna use more than 500?
Because this is your available dose, right? 500.
Yeah, and that is 500. That's why we're using and putting 2 ml. And the stock dose will be 225, right?
Yeah, this is the final concentration.
Okay.
Okay, so we have to divide 450 divided by 225. Okay, times 1. So 2 ml. So to cancel this out. So we're going to withdraw 2 ml. So this is your dose.
So how can I compute for a flow rate by using a pump?
Okay, when you want to calculate for the flow rate using a pump, the formula is amount of mini bag over the monograph specified run time. So we have to use the monograph for the minutes times 60 because in 60 minutes we have, or in 1 hour we have 60 minutes, right?
Okay. Yeah.
Okay, so this makes the ml per hour. Okay, so we're going to check for cefazolin. So for cefazolin, the infusing time for slow venous infusion is 15 to 30 minutes. And for the dilution, for IV infusion, you have to dilute the required dose of cefazolin in a 50 to 100 ml of the appropriate IV fluid, which can be D5 water, normal saline, lactated Reinsurance, and TS. Okay, so first we're going to use the 50. Which one would you like to use for the mini bag? Is it the 50 ml or the 100 ml?
Let's use 50, I guess.
And for the time, would you like? We're going to use first the 15 minutes. Okay.
Okay.
Okay, for the amount of mini bag, so you want to use 50 ml over 15 minutes. Then you have to multiply this for 60 minutes in 1 hour, right?
Yep.
Okay, so we have to cancel the minutes, so we have to cross multiply. So 50 ml so 50 ml times 60 divided by 15 minutes, and that will give us 200 ml per hour. Okay, so 200 ml per hour. Now we're going to use the 30 minutes.
Okay.
So same amount of mini bag is 50 ml, right?
Yep.
divided by 30
30
minutes. Multiply it in 60 minutes
per 1 hour.
in 1 hour. Okay, so 50 times 60 divided by 30 equals 100 ml. So cancel per minute. So we have 100 ml per hour. So that will be the flow rate using the pump with the 15 minutes and the 30 minutes time interval.
Thank you. What if I'm not using pump? How can I calculate the flow rate?
Okay, so you can also administer it via gravity.
Okay.
So if you want to do it via gravity, the formula is going to be volume in ml times the drop factor divided by time in minutes. So
Okay.
let's say that drop factor is 10. So it's going to be 10 drops per minute. So that is your drop factor.
Okay.
So according to our monograph, we can use 50 to 100 ml. So let's say we're using 50 ml. So it's going to be volume in ml, that's our mini bag. It's going to be 50 ml times our drop factor, which is 10 drops per minute, divided by time in minutes. So for slow venous infusion, we can infuse it over 15 to 30 minutes. So
Okay.
we'll try 15 minutes first. So 15 minutes. Okay, so that will give us 50 times 10. It's gonna be 500 divided by 15 minutes. So 500 divided by 15. So that's gonna give us 33.33.
Okay.
So we're gonna round it off to a whole number to make it easier to count. So it's gonna be 33 drops per minute.
That is for 15 minutes, right?
That is for 15 minutes.
Okay.
If we're gonna do it in 30 minutes, so it's gonna be 50 ml, again times 10 for the drop factor, divided by 30 minutes. So it's gonna be 50 times 10, which is 500, divided by 30. That's gonna give us 16.66. We're gonna round it off to a whole number. It's gonna be 17 drops per minute. So you're gonna run it 33 drops per minute for 15 minutes and 17 drops per minute for 30 minutes.
Okay, thank you. The formula for drug calculation or for dose calculation is desired dose over stock dose times the vehicle. That will be the dosage of the medication. Okay, and for the flow rate, we need the amount of mini bag time is 60 minutes over what is on monographs specified run times. Okay, and that is using the pump. And for the flow rate, using the gravity, we have the volume in ml times the drop factor over time in minute.
Okay, thank you so much for your help. For reviewing my dosage and my flow rate, and I'm hoping I can work with you guys. Thank you so much.